Hello, I'm Brian Haug, President of the American Journal of Managed Care.
And I'm Justin Gallagher, Associate Publisher.
Welcome to This Week in Managed Care from the Managed Markets News Network.
In our top story this week, all eyes are on the Supreme Court as states await the outcome of King v. Burwell. The case, which will decide whether consumers who live in states without their own healthcare exchanges will be allowed to use premium subsidies to buy coverage. Up to 6 million Americans may be affected. Earlier in the week, 3 states, Arkansas, Pennsylvania, and Delaware, won approval to set up exchanges to protect their consumers from losing subsidies. If the court rules for the plaintiffs, experts predict the ruling will bring uncertainty to the insurance markets in states without exchanges. Healthier consumers may stop buying coverage, which will force up prices.
The ruling comes as 2 new polls reveal different views of the ACA. The Kaiser Health Tracking Poll found that overall, Americans remain divided about the law, with 39% viewing it favorably and 42% viewing it unfavorably. However, a separate study from the Commonwealth Fund reported that Americans who have found coverage through the exchanges are overwhelmingly pleased with it. 86% said they were very or somewhat happy with their insurance.
The Kaiser Tracking Poll also found that 73% of consumers find drug prices unreasonable, and of this group, 76% blame drug manufacturers for the high prices. Most consumers place the blame on pharmaceutical companies, even though only half take prescription medications themselves. But a quarter of those surveyed had a friend or family member who could not fill a prescription in the past year because of cost. Responses were scattered when it came to pinning down the underlying causes for high prices. Consumers named company profits, marketing and advertising, and the cost of lawsuits against drug companies.
Some of the highest drug prices come in cancer care. Alex Bastian, Senior Vice President at GFK, spoke with AJMC about the effect of high drug prices.
Costs have a tremendous impact, and the idea of financial toxicity is one that everybody's considering nowadays. Dr. Safar out of Duke University actually has a great presentation where he says about 46% of people actually cut their basic needs. Another 60% actually have to dive into different things that they spend, whether it be vacations or whatnot. And so I think financial toxicity itself has a dramatic impact on patients.
3 new policies emerged from last week's meeting of the American Medical Association, the nation's largest group representing doctors. To increase access to integrated medical and behavioral health services, the AMA has called on Medicaid and state health insurers to pay for coordinated care. The AMA also recommended that Medicaid programs pay for behavioral health issues at schools. These changes would affect 43 million adults and 6 million children. Finally, the AMA called for new policies to promote healthcare transparency, to give doctors easier access to data to use in their practices.
This week was the deadline for stakeholders to respond to CMS's proposed rules for mental health parity in Medicaid managed care. Insurers and states did not question the need for persons with mental illness or substance abuse problems to receive appropriate care, but some asked for more time to make changes than the 18 months called for in the rules. However, mental health advocates say it's been 7 years since the federal parity law passed, and Medicaid patients have waited long enough. Former Congressman and mental health advocate Patrick Kennedy spoke with AJMC last year about implementing the federal parity law.
What I'm interested in is working with the insurance community to really develop a process by which we get consensus on what it is that constitutes mental health. And the way we do that is we bring in both the providers and, most importantly, the consumers with the insurance industry and really have an open discussion about what works, and if it works, then obviously we want it paid for.
For the Managed Market News Network, I'm Brian Haug.
And I'm Justin Gallagher.
Thanks for joining us.